We also talk to Stephen Dorrell from time to time, former Health Secretary. Stephen, very good morning to you. Happy New Year.
Thank you, too. Same to you, Mike.
Nice to see you. We've got a big announcement coming today from Sir Keir Starmer. He's come back from his holiday. I spoke to a GP slightly earlier in the show, though, having run past all of these various things. 500,000 more appointments being made available, community diagnostic centres, expanded surgical hubs. He basically said to me, well, most of this stuff's already in place. Some of it is up and running, some of it isn't. But he was of the opinion, and he's not sort of what I would regard as somebody politically on the right, this guy. He just said, I don't see where you're going to create any extra capacity here. It all sounds a bit like, you know, something that might happen in about 3 or 4 years' time.
Well, I agree with you, the guy you had on earlier. I would add to it, Mike, I think that what we're suffering from Wes Streeting, who I broadly like, is there's barely a day goes by at the moment that he isn't on our screens, apparently making an announcement, but not actually changing anything. And
that's the problem, isn't it?
Over the weekend, he was on the screen saying that we were going to have yet another inquiry into social care that isn't going to report until 2028. Now, you can't deal with the health and social care system on the basis that you deal with social care on Saturday and delay it, and then say we've got a plan on Monday to deal with waiting lists. And incidentally, to the announced figures published this morning showing that ambulance waits in the part of the country that I'm speaking to you from, in the West Midlands, ambulance waits, a third of all ambulances appearing at a West Midlands hospital in the month of December had to wait for more than an hour to discharge their patients. Now, this is a system that isn't working, and you can't address it piecemeal. You have to think about it in a joined-up way.
Of course. And, I mean, one story this morning that I read says that more than 1,000 patients a day in England are suffering potential harm because of these handover delays. 414,000 patients estimated to have experienced some level of harm in the past year. You're right. And the problem is that all of these things that I've been reading about, and I read through them in some detail last night, these reforms that Keir Starmer is going to announce today, I mean, they're all very much a delay factor. You know, they're talking about getting us down to an 18-week but no longer wait for an operation in 2029. Well, if you're sitting here right now waiting for an operation that's already taken over 18 months, that's not really much help, is it?
No, I agree. The critique is not that what they're trying to do is wrong. I agree with the diagnostic centres. I agree with simplifying the care pathways. All of these things are important, but relatively detailed changes that do need to be made. And incidentally, as your doctor said earlier, this programme was initiated by the last government and maybe even by the one before. What we haven't had from this government, we're now more than 6 months in, is a joined-up plan that sets out a set of objectives, not just for waiting lists on one day and social care on another, but for the health and social care system as a whole, and tells us how they're going to address the difficult problems that reveals.
Yes, and that is the problem. I mean, talk of, as well, doing away with unnecessary appointments. Well, if they're unnecessary, why are they in the system in the first place?
Well, in fairness, that is one of the things that they are addressing, at least an element of it today, because currently, if the GPs are not allowed to refer people to diagnostic centres, they have to first see a hospital consultant. Well, sometimes that's necessary, but not always. They're taking out the unnecessary appointments. I think that's a step in the right direction.
Right.
But let's face it, it's a relatively modest one.
Well, it is, because, I mean, I don't wish to compare and contrast two things that aren't connected, but I know people that have been seen in private healthcare over the, say, course of the last 2 years, because a lot of people I know, even if they can't afford it, have now taken to private healthcare simply because they can't wait any longer to get something done. And the speed with which it gets done, and the speed with which a referral is made, the speed with which diagnostic testing is done, is out of all proportion to the NHS. Why is it that private healthcare can be so much more efficient than the NHS?
Well, in some aspects it is, and in some aspects it isn't. But taking the specifics of attending for a diagnostic test, that it's undoubtedly true that modern diagnostics allows you to complete the diagnostic process much more quickly than traditional systems did. And the health service too often still relies on the the old-fashioned timings, which were necessary with the old technology, but are not necessary with the new technology. And that is one of the issues that I think is now being addressed, but as so often happens, too slowly and in a piecemeal way.
But this is my thing, you know, it's somebody that I was speaking to the other day had to have some tests done, some cardiovascular tests or something like that. They went to a private clinic. The reference was made. The booking was made. I think within 2 weeks they had the tests, and another day later they had the results. Similarly, if you try and do that with the NHS, they'll be booking you in for some time in October.
Well, probably not October, to be fair, but not in an acceptably timely way. And
I guess what I'm saying to you, Stephen, is that surely that's a matter of efficiency. It's not just a matter of scale. It's a matter of efficiency.
Well, it's a matter, and it's something. The health secretary, I've been there. I've sat behind the desk. I've got the T-shirt. You can't plan hospital appointment system from the Secretary of State's office. What you have to have is systems in place in hospitals that deliver the detailed changes that are necessary to patient pathways, is the jargon. So the plan, the way in which a patient with a particular condition is dealt with by the system. That's something that where NHS pathways have not kept up to date with the opportunities that exist because of modern technology to make them simpler and most importantly, from the patient's point of view, quicker and cleaner.
Yes, exactly right. I mean, we saw a story just last week from a study that was done of the amounts of money being spent in the NHS. £1.1 billion extra has gone in the last 10 years on NHS managers. You know, while at the same time, over 1,000 GPs have disappeared from the system and there's not enough money to hire any new ones. So there's clearly an issue, isn't there, about the way the money is spent and the way the management is arranged.
Well, in any large organisation, we're talking here about 10%. I call it a large organisation, I'm wrong. It's a set of organisations. It's 10% of everything that happens in the UK economy. So unsurprisingly, there are bits of it that work better than other bits.
Yeah.
What we're not good at is taking the bits that work well and insisting that the rest of the system matches those breakthroughs.
Yes, I think that's right. Stephen, good to talk to you as ever. Thank you very much indeed.